Kia ora, how are you today?
I'm fine, thank you.
Oh, lovely. We'll start it off pretty simple, I hope. Just tell us a little bit about yourself, your name, who you work for.
Yeah. My name is Judith. I work for Positive Women as a community health and support coordinator. Positive Women is an HIV organization. We support the women and the families living with HIV here in New Zealand.
Fantastic. And how long have you been doing that work?
In the HIV field, I've been working there more than 10 years, but I have been working for Positive Women. I started last year in November, but I have been working for them before and then got the job with Benefit Foundation. Then I'm back there.
Oh, lovely. Love to hear it. I guess we would love to have you here today to shed a little bit of light on HIV and a lot of the misconceptions around it. It's a topic that not a lot of people are very educated about. So we want to really make sure that we ask you some questions that we've heard from the public, as well as ourselves at iView, about HIV in general and how we can learn about it. So I guess the first question we have for you, what are some misconceptions about HIV that you have encountered and how do you address them?
Right. The most misconception around the HIV are faced or are still facing is they are wrapped around the HIV transmission. Majority of people assume that they can get the HIV through touching or kissing someone living the HIV, which is definitely not. So the way for me address those misconceptions or how someone else should address those misconceptions is to provide the right information, the correct information, how people can get that HIV, how they can prevent it. And also, I guess the language we use around the HIV also can lead to the misconception or the fear of the HIV. For example, people they say AIDS when they want to refer to HIV. Those two terms are completely different. And when then there is a misunderstanding of those two, it can cause a lot of fear.
Absolutely. And could you be able to let us know what the difference is between HIV?
Yeah. So the HIV is a virus. The virus people can live with it for a long time. And if people don't take tests, they will never know. It could take more than even 3 years without realizing they have the HIV. But the AIDS is a term that used, especially with the health professional when they want to describe the group of the illness that caused by that virus, that caused by HIV. So therefore, the HIV is a virus that caused the AIDS. So the AIDS is a disease.
Oh, yeah. Thank you so much. Yeah, I think that's a big misconception that people confuse. And then when you use the terms interchangeably, it makes it hard to differentiate between them. So thank you so much for shedding light on that. Because our next question is, what are some barriers that prevent people from testing and seeking treatment for HIV?
Yeah, the biggest barriers I can say is the stigma and the discrimination. The stigma and the discrimination prevent people getting tested because they must hear how people living with HIV are being judged or discriminated, and therefore people don't come forward for test. And also with the stigma, people have they could they don't seek getting tested or seek getting a medication and taking the treatment because they have a fear for people seeing them taking the medication or working in the building where they are going to have an HIV test. So the stigma is the biggest barrier to prevent the HIV and also the treatment. We have a few people here or have a few people who have refused to take the medication because they don't want other people to see them taking that medication. And that's putting the people on the risk and also preventing us to beat the HIV infection.
Currently, what do you think are the most effective ways to prevent HIV transmission?
Yeah, the biggest way we can prevent the HIV is we have a few tools that can help us to prevent the HIV. The first one, a very important one, very successful, is the condom. The condom is still the best tool to prevent the HIV. Not only does it prevent the HIV, it prevents also other STIs, gonorrhea and chlamydia and hepatitis C. And the second, and the good things these days, we have male condoms and we have female condoms. So women don't rely only on the men wearing the condoms. The women can also wear the condom. And the second tools, it is HIV test. It's very important. Everyone should know the HIV status because the research showed it's easy to transmit the HIV if you don't know you have that virus. So therefore, it's very important individual to know the HIV status. The third one I could say is the PrEP. The PrEP is it is an medication that prevents the HIV. That gives the people the option. If people don't like to use the condoms, they can use the PrEP because the PrEP is a medication. People can take it as a daily medication, or they can take it in a way we call it PrEP on demand, which they take the medication, that PrEP, and the time they think they will be exposed to the HIV. So that is the third one. And the fourth one, it's an HIV medication, what we call the antiretroviral. The HIV medication, it doesn't only improve the health of someone living the HIV, it's to also prevent someone to transmit the HIV. Because once someone is on a medication, they have a higher chance to reach the stage we called undetectable, which means that they have a smaller amount of HIV virus in their blood system, and those smaller amounts of the HIV are not effective to be transmitted to some HIV to someone else, even through the sex. So that is also another key that helping us to prevent the HIV, especially here in New Zealand. Another one I can say is what we call the PEP. The PEP, that is abbreviation of the post-exposure prophylaxis. It's a medication that can be taken by someone who think they have been exposed to HIV, but it have to be taken in 72 hours after being exposed to the HIV. Yeah, so there is no reason people should say HIV can be prevented, and we have the amazing tools here in New Zealand to do so.
And where can people get tested for HIV?
It's simple these days, thanks to the technology or the science. People can access the HIV test in the community, especially the HIV community organization, Positive for Women, Body Positive, for Benefit Foundation. And those ones, they can offer the free HIV tests when the people think, when they go to the GP, probably they don't have, they can't afford the GP fees. So, or they can go to the sexual health service too. They offer the HIV test, free test. But if you are not New Zealanders, you don't have a New Zealand residence, that could be cost. But again, we are there in a community with an HIV community organization. We offer the HIV test for free.
Amazing.
To anyone.
Wow, that's awesome. I guess with HIV destigmatization, a lot of people don't know what it consists of. So what are some of the challenges faced by people who are actually living with HIV?
I'll tell you what, there is a few survey or the research that was done here in New Zealand to measure how people in the HIV in New Zealand feel or how they are. So that one of the research showed us more than half of people in the HIV here in New Zealand, they are all experiencing the stigma and the discrimination. And that is nearly half of them. It's a high number. And so with that stigma and the discrimination, it's leading the kind of mental health issues in the community among people living the HIV. Because you can imagine the stress, the frustration, the face the rejection, because some of them, they have been rejected by the family, they have been stigmatized by health professionals and their care. So that leads them more stress and cause more harm to their mental health.
Absolutely.
Another challenge I can say is kind of some of them feel like loneliness, because if they are rejected by the family, the community, therefore they don't have someone around them. And also because of the stigma, they can't share that information with anyone because they are worried about the stigma or how they can be judged.
Thank you so much for that. I think following up with that question, how do you think that New Zealand society can work to create a more welcoming and supportive environment for people who are actually living with HIV?
That is a perfect question.
Good follow-up.
I can say to prevent HIV in New Zealand, or to make New Zealand a safe country for people living with HIV, or to have zero HIV transmission in the country, everyone should take the responsibility. I can say individuals should ask themselves, say, am I part of the problem or am I part of the solution? Because if you don't know about your HIV status and you are having a protected sex, you could be part of the problem. You could be the one who's transmitting the HIV. If you are using those misconceptions, judging people in the HIV, using those languages that cause the stigma, you are being a part of the problem. But if people then decided to use the condoms all the time, or hard use a PrEP, or take the HIV test anytime they think they have been exposed to HIV, and then they are doing good. They're helping everyone to prevent the HIV. So it's everyone's responsibility. Some people, they assume it's people who live in HIV should take the action. It's a total other way around. It's everyone else who should be part of it.
Absolutely. And do you think there are good online resources for people to actually figure out how to be supportive?
Yeah, and in New Zealand, we are so lucky. For me, where I come from, I can say we are very lucky. The resources are there and are available online in the community. Anywhere you go, you can find those information. And let's say like people want the condoms. They are free condoms. Even people can order it from the website and they deliver the condoms at the home. That is an example. The HIV test is free. So the resources are there. And people, they can go on the website to search. I'm not encouraging people to Googling, because the Google, it can give the wrong information, a scary thing. But if you go on the trusted website, especially for those HIV organization or international research, that is a good thing, so where you can find the best information.
Yeah. And do you think there has been a change over the last few years or last few decades to remove the stigma?
I guess for me, from my experience, when I started working in the HIV field, I think we are getting better. Not there.
Absolutely.
But not there, but we are getting better. I think it's people like you who decided to take this topic and share it with everyone else who are contributing to do better. And the more people are educating themselves about the HIV, the more we beat the HIV in New Zealand, and the more people living the HIV will live happily after.
Our next question is, what topics are you currently working on?
That's a big question. There is many projects we are working on, but there is two probably I would like to share. Currently, we are working on a project we call it Aging with the HIV. Because when you look for the HIV, people are not dying of the HIV because of the HIV anymore. In the 80s, the AIDS used to wipe off many people because of people didn't have the medication and they didn't know how they can prevent the HIV. But now, because of the medication, people are living longer, healthy. They have a normal life like anyone else. And therefore, people are aging with the HIV. So the project we have now it is kind of working on how people should they care for people living with HIV, because that is a new thing. So people, I guess in our system, in our care, they are focusing on HIV medication, saying people living with HIV take your medication, that's it. But they forget the people living with HIV could have other health issues, or when they are older, like anyone else, how their care will be done. And because also, like I said, the stigma is still the big issues. If someone aging goes in a rest home and home care, the person who comes to provide the care should understand about the HIV. Otherwise, they will be facing that stigma until they die. Another project we are working on, we call it, we still trying to find the name of it, but now we are calling it the Refugee and Immigrant Project. The reason of that project is because there is a kind of a survey that shows us the majority of people who come here in New Zealand, they assume there is no HIV, all right? But majority of them, they come in the country where you can see they have the HIV high prevalence, and therefore some of them, they could come, they are already affected by HIV. Or they don't have enough knowledge around the HIV, so when they come in the country, they think there is no HIV, which is not true. So also in that community with refugee and immigrant, because of the culture, the beliefs, they still have more stigma around the HIV. So for us, the project we are doing is to help us to improve, to raise awareness of HIV in that community, and also encouraging them to seek medication if they are living with HIV and support, and also to help us to reduce that stigma. Therefore, the people in that community can come forward for the test or the treatment.
Absolutely. Next question would be, how have you seen HIV treatment change over recent years?
Yeah, yes, things have changed. Can I give you an example of what's in my head, top of my head? I remember a few years ago, we used to have like more than 250 people new diagnosed of the HIV here in New Zealand. But recently now the number decreased. We are getting less than 100 new HIV diagnoses in the country. That is because there's tools that are helping us to prevent the HIV. There is the condoms, there is the PrEP, there is the HIV medication for anyone who tests the HIV in New Zealand can access the HIV medication regardless the visa status. And there is a PrEP. If someone thinks they have been exposed to HIV, they can take that medication, and as long as taken within 72 hours. Yeah, so there is those tools that helping us, and therefore we believe in a few years coming, New Zealand could have a zero new HIV transmission.
That is amazing. And I think that's a big testament to all the work that you do as well. So thank you so much for educating us, but also doing all the work behind the scenes that maybe sometimes people don't actually see or know about. Thank you so much, Judith.
Yeah.
I look forward to seeing your work.
Thank you for having me.